it's really scary. I mean, half of all women with postpartum illnesses never disclose. So there's a lot of women that will never seek help because they're frightened, they feel they'll be judged, they feel that they'll be labelled as a bad mum.
Thank you for joining me today. My name is Christa and I'm from Mommy Knows Best. And today we have a very special guest. Her name is Dr. Rebecca Moore. She's a reproductive psychologist and she's going to be talking all about birth trauma, different ways of healing after birth trauma. So thank you for being here, Dr. Rebecca.
Thank you very much for asking me to be here.
Absolutely. So just to get started, can you just tell us about you?
I work with women and their families through any stage of their pregnancy and up to a year postnatally. I suppose things run a little bit differently here in the UK to in the US. I work with women to support their mental wellness, and that includes a whole range of things that they might come and see me with. So that might be depression or anxiety or bipolar disorders, or it might be about attachment or bonding. But my real passion and expertise really is around supporting women who've had a traumatic or a difficult birth, because we know that that is often not well diagnosed or detected, and that can have really life-changing impact for mum and the entire family as well. So I'm working in the community in a variety of settings, seeing mums, seeing their partners and carers, and also do a lot of lecturing. And I'm also involved in a national collaborative called Make Birth Better, which is about reducing the impact of birth trauma and raising awareness with campaigns and research.
Yeah, like you said, I'm sure it definitely differs from the US, UK. But one thing that you said that stuck out to me is that it is not always diagnosed correctly. And that's so important because there's so many women going through it and they might not know they are going through it. So what are some of the different ways that birth trauma will present itself in mothers or just family members?
Commonly what women will feel is that they're constantly thinking about their birth to the point where they just really can't think about anything else, that it's constantly in their mind. They're replaying it from the moment they went into labour to the moment that baby arrived. Every moment of that experience is in their head, and it can feel very intrusive that it's just looping round and round in their head. They also might be replaying it in nightmares, in their sleep. They might feel very sort of on edge and anxious that something bad is going to happen, that something else might happen, if they felt very powerless and out of control at birth. Often people feel their mood is very changeable. It's angry, then it's tearful, then it's sad, it's very up and down. And often you will get an avoidance of things that make you think about the birth. So for some women that might be that they can't see pregnant friends, that they don't want to see anybody who's about to have a baby or has a new baby. They might not want to go back to the hospital where they gave birth. They might avoid medical professionals, or for some women even they might avoid their baby because that's a very powerful reminder of your birth. And often it has huge impact for couples, that they find it very difficult. Often mums can have problems with sexual drive and not wanting to have sex in case you get pregnant again, because then you might have to give birth again. So, it can really ripple out and cause a lot of issues. I think in terms of processing your birth, it's about thinking about, we can all perhaps have some of those feelings that perhaps last for a few times, because I think for all of us, it's very rare for somebody to have the perfect birth. For all of us, perhaps birth is moments of joy, moments of pain, moments of tiredness. It's a mixture. But if you're having those very intrusive thoughts about your birth most of the time, most days, then that's probably something that you would benefit from getting some support around.
Definitely think that the support is huge. When different moms suffer with anxiety and depression,
it's always about thinking with that woman about what she wants and what she feels would suit her. So that might be changing the way you exercise, doing meditation, journaling, changing your diet, adding in supplements, having therapy or medication. And it can be any combination of those. There's no right or wrong. it should always be about what you want. Some women would never want to take medication. Some women really want to take medication, and both of those is fine. But I think for a lot of women, a really good starting point is therapy. Specific trauma focused therapy can be really, really helpful. But I know, sometimes there's cost implications for that, and then not all people can afford that. There are a lot of therapists that will offer to do things at a reduced rate, I think. And there are also some really good online resources that if you can't get to therapy, or you just don't have the money for that at this time, that you can start to look at and work with even yourself trying to do that. I think the other thing that could be really, really helpful is sort of reconnecting with your body, because I think sometimes when we've had a really difficult birth experience, we can often walk away feeling that our body's failed or it's let us down. Or sometimes women have had physical birth injuries as well as birth trauma, so they've had tears or they're left with incontinence. So there's, it's really important sometimes to try to reconnect gently with your body. And trauma is often held in the body, it's often a very physical thing. So for some women, things like massage or Pilates or breathing can be a really gentle way to start to heal as well. So there's loads and loads of different ways. Yeah.
Awesome. So I'm hearing too is it's very unique to each woman, because everyone has their own preferences or own diagnosis too. It's going to be completely different.
And everyone has their own birth story. The whole nature of birth trauma is that what one woman finds traumatic, the next may not. So you can see women where they've had every single medical thing go wrong, but what they've had is somebody with them that's consistent and constant and kind and compassionate, and they walk away from that experience feeling okay. Whereas you can see another woman who on paper seems to have had a really quick, easy vaginal birth, but actually felt really alone and really out of control and really frightened because nobody was communicating to her, nobody was talking to her, everybody was using very medical language. So it's a very personal experience. And so to me, everybody I work with, actually, because we're all unique, we all need a unique treatment plan as well, because what you need is not what I need. And why should it be? Because we come from different countries and different backgrounds, and so it's really about making it bespoke to that person.
Awesome. And I know you mentioned UK and the US is going to have very many different ways of how they diagnose and how they treat people going through this. So how can women in the US system seek out help for this?
It's very, very variable in the US. It depends what state you live in. It's very different. The provision is very different. I think if you have, a good obstetrician that you might be seeing postnatally, it's worth trying to speak about with them. I know that sometimes the response is really variable and sometimes it's not a good response, but asking them if they know of any local therapists or support groups or places that women can access support. Sometimes you have to look for it yourself, I'm afraid. Find therapists in your area that have an expertise in working with women in the postpartum, or look at something like a national website like the Postpartum Support, which lists every state, and there's somebody in each state that you can contact. I think for a lot of women, it becomes something that they would do perhaps in peer groups and support groups online. So there's lots of really amazing groups in the US, like Mothers with 4th-degree Tears is a really good active group for women who've had physical birth injuries. There's an amazing woman called Ashley Sipes, who's based in Carolina, who has a website, who networks around birth trauma. So all these kind of people you can get in touch with and reach out to. But I think it takes real courage to let somebody know how you're feeling. And I think if you can, take somebody who can advocate for you, take somebody who, if you lose your voice in that moment, can speak for you. If you look at Make Birth Better, although we're UK based, we actually have members from all around the world. And we have some free crib sheets on the website, which anybody can download, which list symptoms that you might be experiencing that you can maybe check off and then take to your provider. And that sometimes can help to start a discussion if you feel that you can't quite say it yourself. And sometimes providers don't really know much about birth trauma. So you might have to push and say, look, I've got all these symptoms and I think that I'm experiencing a birth trauma. I wish that women didn't have to do that, but I think we have to accept that the reality is that sometimes you will have to push for a bit of care yourself.
I think that's really helpful too, because like you said, it might be hard to have a voice in those moments. So having something they can like look at and see that, you know, it's so normal and so many people go through it. So if they can just, you know, check a box and open up that door to start talking about it, I think that really helps.
Yeah, I think it really helps women because, you know, it's really scary. I mean, half of all women with postpartum illnesses never disclose. So there's a lot of women that will never seek help because they're frightened, they feel they'll be judged, they feel that they'll be labelled as a bad mum. To actually get to the point where you go and tell somebody is a big step. So I think anything we can do to help women, you know, give their providers more information, make it an easier consultation, we should be doing.
How are ways that we can prevent birth trauma?
In the US, where we know that births are perhaps much more medicalized, that rates of episiotomies are soaring, that, you know, there's lots of talk about obstetric violence and less consent often. I think it's really important to know that you can question what people are doing during your birth, that you can ask questions of your provider, that you can ask them to explain what they're doing, and that you can say no, that, you know, you can choose what to do and what not to do. Because I think often women in the US particularly are here, you know, getting very bullied into having procedures that they don't really want, or it's a much more medicalized model. In the UK, we have a primarily midwifery-led model, so it's very different. So I think if you're facing that in the US, it's about really carefully choosing your provider. Also, you can look at Birth Rights, which is an amazing organisation that has some free fact sheets that you can download, again, that talk about consent and your rights as a pregnant person, that you can maybe take into your appointments to just promote a discussion. So I think don't be afraid to challenge your providers. Don't be afraid to question why they're recommending procedures, because they're not always necessarily, might not be what you want or what you need.
So for someone watching that may have some of these symptoms of birth trauma or might be concerned that they are going through something, so they might not be sure if they should go seek help, what would you say the next step should be to kind of figure out what's going on?
I think it's always about the intensity of the symptoms. So if you're having those feelings all day, most days, and it's stopping you from doing your normal stuff, stopping you from sleeping, stopping you from communicating, that you're just constantly thinking about your birth, then it's perhaps time to seek some support. So if you have a good obstetrician, great, try and speak with them. If you have a really good family healthcare provider that you've known for a long time, perhaps try and speak to them. Perhaps try and check out what's available locally in terms of therapy. If you want to look at Birth Better, there are loads and loads of resources there that are not just UK specific. You can message us, you can email us, and we're happy to signpost people for support, because I know sometimes it can be so difficult to know where to start. It can feel really overwhelming. So if you want to contact us, we're more than happy, and we can put you in contact with people more local to you. Or look at some of the support groups online. There's some really good closed groups around birth trauma. The Birth Trauma Association has a really good active closed Facebook group, and often women can get lots of support from women that have had similar experiences, and you can be anonymous on social media, so nobody needs to know who you are, and that often can help you speak a bit more freely. So those could all be places to start.
Just knowing that there's so many ways that they can get support, and know that, again, that there's other people going through what they're going through, and there's something out there for them. For moms that maybe have, you know, a partner or family that doesn't really understand what they're going through, what's a good suggestion for them to be able to talk to their family and explain what's happening?
Try and speak to a healthcare provider, because many of them will be very willing to listen and might be able to point you in the right direction of other sources of support. If you really haven't got anybody to talk to, I know that's such a difficult place to be in. But I think sometimes then women would write a diary or a journal. So if could at least get some of it out on paper, that could be really, really helpful. And then, even just trying to do things where you get a moment of space for yourself. So like a short walk around the block, or you could just have to do what you can if you really haven't got anybody else to talk to. But I think try family, try friends, try professionals, try online. And I think for most women, they can find somebody within that group that they really click with and connect with, and then that can be so healing.
So helpful to know, because I think so many times either moms are far away from their family, so they just kind of feel very alone, and even more so alone when family and friends are far away. So I think those online communities are huge too. I think the groups are a great way to kind of find moms going through the same thing you are and getting that help online.
In the UK, we also have some apps that connect mums that are geographically close to each other, that mums can sort of chat to each other and then meet for coffee in the real world. So, things like that can be really, really helpful as well, because you can start to connect with people that are close to you.
I always like to ask everyone I interview, if you could have a billboard made today where you would share one tip with moms everywhere, what would you have it say?
I want to write lots and lots of things on the bill.
Right? How much can I squeeze on there?
You are enough in this moment, and you will be enough tomorrow, and things will shift and evolve, but you are always enough.
Even though as many times as that is said, I think it never hurts to hear it again, because having the reminder and letting moms know like they're doing a great job and they're not alone, because even if they feel alone, there's so many other moms going through the same thing, and that support around them. I know I learned a lot here today, and I know the moms watching are going to learn a lot too. So thank you so much for taking the time and sitting down with me and just, sharing with us your knowledge on birth trauma and just different ways of healing. I think that's huge. Can you share your Instagram handle for everyone, and then they can go ahead and follow you as well?
Yeah, so I'm just at Dr. Rebecca Moore, and then Birth Better is at Birth Better. So certainly the Birth Better website is just makebirthbetter.org. I'd really recommend, if anybody doesn't quite know where to start, to have a look at that, because there's a huge amount of resources on it. And like I said, there's some free printouts. There's also some slides and videos that people can use that you could even take to train people that you're working with locally. So just talks about what birth trauma is and how we can support women through birth trauma. So anybody in the US can download that, and if they're working in a hospital setting or a community setting, you're very welcome to use it as part of teaching and training.
Oh, wow. That's amazing. That's really cool to have all those resources. Very cool. Awesome. Well, thank you everyone for watching. Again, my name's Christa from Mommy Knows Best. You can follow us on Instagram and Facebook at Mommy Knows Best. And we also have our private Facebook group called Mommy Knows Best Judgment Free Mom Tribe.